Hello everyone, this is your favorite number 24, Marixa Wilson-Ervin, and I'm going to be speaking about COVID-19 and physical therapy. And so a couple of key things that I want to focus on are maintaining good oxygen sats while maintaining a good physical therapy regimen. I also want to educate on pursed lip breathing, a couple of common household items that you can use to maintain that regimen, and then I have a couple of colleagues who are going to both give a demonstration and also speak upon a couple of cardiopulmonary tips for you to kind of think about during this COVID-19 pandemic that we are experiencing. I wanted to speak on the importance of purchasing a pulse oximeter. A pulse oximeter measures your heart rate and your oxygen levels. It's important to have an oxygen level of at least above 90%, and you want a heart rate beats per minute between 72 and 100 beats per minute. I've enlisted the help of one of my physical therapy colleagues, Arisa. Thank you, Arisa. And she's going to demonstrate the proper techniques and a common household item that most of us have in our kitchen right now, a canned good. It can give us a resistance of about 1 pound. So first she's going to do a couple of arm exercises in multiple planes, and we want to keep it at 3 sets of 10. She's doing it in a slow and controlled manner, and she's also practicing pursed lip breathing, smelling the roses and blowing out the candles. You want to make sure you have a good and steady lung capacity. She's doing a great job. Also, we can transition into standing squats. If you're having issues with balance, you can always use the back of a chair or sofa to assist with that. She's going to demonstrate standing marches as well, a nice appropriate curvature, arms outstretched, and again with pursed lip breathing techniques to reduce any episodes of shortness of breath. We want to make sure that this heart rate is 72 beats per minute, oxygen levels above 90. We want to check this before and after exercises. I also wanted to enlist the assistance of my other physical therapy colleague, William Robinson. Thank you, William. And he's going to share a couple of tips on cardiopulmonary techniques as it relates to pneumonia.
All right, so here are a few tips for decreasing your risk for getting pneumonia during the COVID-19 pandemic. Even though you're not feeling your best, it's still great to get out of bed and be out of bed as much as possible. Being out of bed decreases your risk for getting pneumonia. It also decreases your risk for muscular atrophy. It also enhances your lung capacity, and it gives you the ability to have your systems adjust to atmospheric pressure changes. So getting out of bed is a great thing even though you're not feeling well.
Thank you so much for allowing myself and my colleagues to share some tips from physical therapy. And I also want to stress the importance of really purchasing one of these pulse oximeters. It can be purchased at your local Walgreens, Walmart, online, Groupon, anywhere. Stay safe.